The SAFE-DCB Registry is a prospective registry, US-based, 74 sites, designed to evaluate the safety and effectiveness, of the Lutonix drug-coated balloon in all comers, a real-world registry. It's a registry that had 1,005 patients. Again, it's all US-based. It didn't have a CEC or a DSMB kind of type of committee to monitor, but it did have a medical monitor evaluating very much all the outcomes. And the primary, effectiveness endpoint is the freedom from target lesion revascularization at 1 year. There will be a follow-up at 2 years and 3 years. There is a lot of other data, looking at various subgroups in the registry, given the large size of the registry. So we could look at males versus females, long lesion versus short lesions, limb ischemia versus non-limb ischemia patients. I think what's unique about the registry is the fact that it had a large number of patients with limb ischemia, about 35%. Also, it did have a large number of diabetic, over 50%, were diabetic. And nicely enough for the registry, we had over 45 or so percent in females, which are very important for the Lutonix drug-coated balloon to evaluate because of prior data that indicated possibly lack of effectiveness in this subgroup of patients. So in this registry, we could evaluate that in a large number of patients. So, as I said, we have 1,005 patients enrolled. A few patients, we lost follow-up to them. Some people died and some people withdrew their consent. The number of patients we have a 12-month follow-up for that they actually had an in-office visit, and that we, per the registry, they are the one to be analyzed. There were about 744 patients. So it's a very good number of patients, nicely represented from, as I said, 74 sites in the U.S. Again, the primary endpoint, as we said, is an effectiveness endpoint at 1 year, looking at freedom from target lesion revascularization. And the freedom from TLR was excellent. At 1 year, it was 89.5%. Puts it very high in terms of a drug-coated balloon effectiveness. And that falls perfectly in line with what we have seen with the Lutonix data before. In fact, the Lutonix EU long lesions, the Lutonix global registry, all those kind of reported essentially in that same 85 to kind of 95% range of freedom from TLR, and we fall straight in the middle of this. So that was very important. The second, that's especially important for a couple of other reasons. First, because we have a lot of female in that registry, which is really good, and also because we had a large number of limb ischemia patients. So looking at these high-risk kind of type of patients with limb ischemia, looking at the large number of diabetics, we think this is a very good freedom from TLR number. So this is obviously a very important question nowadays about safety, with the DCB balloons. Again, as you know, the safety concerns didn't appear till the second year and up to 5 years in the meta-analysis, that has been reported. So we have up to 1 year follow-up, but even at 1 year, the total mortality in the SAFE-DCB was 7.1%. So if you look at the limb ischemia patients, 35% in that registry, and you look at the large number of patients with diabetes, and I failed to mention there's over half the patient had coronary artery disease. So polyvascular disease, large number of limb ischemia, large number of diabetics. We think that 7.1%, if anything, is probably smaller than expected. Well, that should hopefully, give some reassurance, to the operators that we have an effective technology, that has very good outcome at 1 year. Hopefully, that will continue to be the case at 2 years and 3 years, as we follow those patients. But also emphasize the importance, of technique, when you deliver the drug-coated balloon. During the SAFE-DCB Registry, we emphasize to all the investigators to follow proper technique in delivering the balloon. Keep your pressure, over 7 atmospheres. Keep the inflation time, over 2 minutes. And at the same time, keep your transit time of the balloon, less than 30 seconds. All these are very important. The other thing is this registry also, is unique in a way that we have a lot of atherectomy performed. So the bailout stenting, in this registry was less than 1% for actually take that back, the bailout stenting was about 1.7%. The total stenting, in that registry was just a little bit less than 14%. So compared to other registries, where we see real world registry, we see stenting in the 25% range or so. This is substantially, it looks at least less, and I think it had to do a lot with vessel prepping. So again, I think that registry sends in a second message that maybe vessel prepping is not a bad thing if you want to follow a no-stent strategy on your patients.